Moving on to the news about the vaccine procurement, we've been reporting about the efficacy of each vaccine as well as when we'll be getting the vaccines. But somehow the vaccine procurement has turned into a political debate here. And recently, the public health minister had to clarify about the vaccine deals. So the public health minister Anutin Chanvirakul has acknowledged progressive movement leader Thanathornจึงรุ่งเรืองกิจ's doubts and reservations over the vaccine deal between Siam Bioscience and Oxford AstraZeneca and thanked him for his support for medics in their tireless efforts to contain the COVID-19 pandemic and for not repeating his controversial reference to the deal as a royally sponsored vaccine. In a Facebook post addressed to Thanathorn intended to clarify the details of the vaccine deal, Anutin explained that both the Public Health Ministry and the National Vaccine Institute have been dragging their feet over the procurement of COVID-19 vaccines for the Thai people. He added that when they started working on the issue last April, the main focus was on dealing with the pandemic and any public disclosure of the deal, which was still being negotiated, would have confused the public and might have adversely affected the procurement efforts. He said that it took officials quite a long time to negotiate the best deal for Thailand, which is safe and effective for Thai people. The minister admitted that during the negotiations with several potential vaccine suppliers, there were both legal and budgetary limitations, as well as conditions set by the manufacturers. He said that all vaccine producers had set as a precondition a non-refundable down payment to help finance the vaccine's development. He explained that this is against the Thai law, although the manufacturers had promised discount prices for the vaccines in case they were proven to be effective. Taking into consideration the legal constraints, the production technology, the available sources of vaccines, public access to vaccines, and the optimum use of funds for the vaccine program, Anutin said the Public Health Ministry and the National Vaccine Institute ended up choosing the vaccine from Oxford AstraZeneca, which represented the best deal. The minister also explained why Thailand did not join the World Health Organization's COVAX vaccine program, explaining that the program is intended to procure vaccines for poor countries, and Thailand is not classified as such. He repeated that the government is not monopolizing vaccine procurement, adding that any other producers beside AstraZeneca can apply for registration of their vaccines, and other companies besides Siam Bioscience can apply to procure vaccines for use in Thailand. So that is Anutin's response here on the vaccine deals.